It's one of the busiest travel days of the year, yet airlines are canceling flights left and right, in part due to the Omicron surge. As I reported earlier, Dr. Fauci seems to be walking back his own belief that airlines should seriously consider vaccine mandates for passengers sooner than later. Meanwhile, tonight, the nation's largest flight attendants union is criticizing the new CDC guidance on quarantining. Let's get some perspective from Sara Nelson, the international president of that association. Sara, thank you for coming back. I have your statement in front of me. You're pretty hot about this. Rather than read it aloud, tell everybody why.
Sure, Michael. So this seemed to be pushed by the airlines who were asking for a reduction in the quarantine time because of staffing shortages. The biggest concern about that is we're not going to pretend like we're the medical experts here, like we know how many days are the right number of days. I'm not even going to try to say that. But what we said is that we want to hear from the medical professionals about what's right, rather than having the thrust here be about trying to staff flights. And what the airlines are then saying is that that is their focus, which concerns us very much, because what CDC said was they were going to reduce from 10 days to 5 days, but only for asymptomatic people, and if you wear a mask consistently and the right kind of mask for 5 days following. So we want to know that the airlines are then, and the rest of corporate America is focused on public health and safety, and make sure that they have very supportive policies that help workers understand that they have the right not to have to come back to work if the airline's calling them. Delta Airlines announced right away after the CDC guidance, they didn't herald any kind of public health measure. What they said was this is going to give Delta more flexibility to schedule crews. And we're really concerned that's going to put workers in a bad position of choosing whether to stay home and be safe and take good measures for public health, or be forced to come to work and feel like they're going to lose their job if they don't.
I can't help but think, having spoken to Dr. Ashish Jha and then Dr. Zeke Emanuel, both of whom commented on this, that if there were more tests available, a requirement would have been that at the end of those 5 days, you need a test before you can end isolation. I don't know if you heard either of them say that, or if you have a reaction to that observation.
I did, and we certainly believe that would be a good idea. The UK reduced the number of quarantine days to 7, but only after 2 negative tests. We have a testing problem in this country, obviously, and that's part of the logistical problems that make this so difficult. But that would be the better thing to do, because why would we be saying that it's okay to have symptomatic people come back and possibly still be infectious and possibly continue this pandemic? That is the root cause of the whole thing. We've got to get through this pandemic fatigue and make good decisions about how to end it, not add to it.
Sara, I don't know that you could know the answer to my next observation, but as I'm watching television and these terrible stories about flights being canceled during a holiday weekend, people being stranded, not seeing loved ones, all I can wonder is whether sick passengers, in fact, I'll say it more specifically, unvaccinated passengers are getting crew sick. You have any reaction to that, anecdotal or otherwise?
Well, look, of course that's happening, because infections have happened at the same rate as in our communities. So it's not as if the controlled environment on the airlines make it any better. What we have done is controlled the environment to make sure that it's not any worse traveling than going to do any other indoor activities. But of course, sick people are traveling and getting crews infected, and those crews are then taking it home to their families. More likely, crews are vaccinated, at least with the first and second dose, maybe not boosted yet, but this is still a stress and strain on them and their families, and it's some of the reasons that people are a little concerned about picking up that overtime hours in order to make the operation work. You know, air travel is subject to severe weather too, and there's been a lot at play here, but it's really made it very difficult for workers to come to work and feel safe.
So just to button this up, doesn't it mean that Dr. Fauci was closer in the morning than he was in the evening here on CNN to where we need to go, which is, if you want to fly, you got to be vaccinated?
Let me tell you this, Michael, it has been really difficult because we have not tracked vaccinations in this country, so it would be a hard logistical thing to implement, and we don't want to have it solely rest on the airlines or the frontline workers to make it work. But I am more committed than ever to work with this government to find the logistical means in order to put that in place, because this is a safety issue in our workplace, and these conditions now with CDC resting solely on the advocacy from airlines to try to address the staffing issues as opposed to the public health issues make it more important than ever that we try to mandate vaccines wherever we can so that people can have that incentive to get vaccinated and we can all be safe.
In other words, you worry that the policing responsibility would fall to your members, and that you don't think is fair.
That is not fair. That's not right. And it would be a problem for airlines as well. There is not a way to track that right now. This is not something that could be implemented tomorrow and actually work and make air travel more seamless. But what we do know is that the demand came back when people started getting vaccinated and when those mask policies were in place. People had confidence in that. Those safety measures directly relate to our economic security. So we know that mandating vaccines, getting vaccines out to more people is going to make our workspace more safe, is going to allow us to get through this pandemic, connect with the rest of the world, and experience the freedoms that we had before this pandemic. So we would be focused in every way to work through those logistics and make it work, Michael, because it's a good public health safety initiative.
Well, I mean, I think it would be a great way to light a fire under the folks' fannies who have not gotten vaccinated. You want to go get on that plane, then this is what it's going to take. Sara, thank you so much. I appreciate your thoughts.
Thank you, Michael. Have a good night.